I'm using ROSA Hip in my practice today to integrate robotics into my present workflow of anterior hip replacement in the supine position with fluoroscopic assistance. I find that ROSA Hip paired with One Planner Hip pre-operative planning software really adds a preoperative, intraoperative, and postoperative ecosystem to the current care for total hip arthroplasty patients. The ROSA Hip application intraoperatively works in conjunction with my present fluoroscopic workflow. I have the ability to take 7 total fluoroscopic images intraoperatively, so it does not add much to the time of the overall case, but adds the accuracy of the robotic assistance with cup placement, as well as actionable intraoperative data, including leg length, offset, and other parameters associated with total hip arthroplasty. I feel that ROSA Hip application brings a number of advantages to my patients. I can preoperatively assess the components that I'll be using intraoperatively. I can then use the robotic accuracy for component placement and assessment of the final construct before leaving the operating room. And then from the data that's derived from preoperative planning as well as the intraoperative execution, I have data that I can track on my patients through ortho intel and the overall ecosystem with ROSA Hip application to have meaningful data that I can then give back to my patients and help them through their continuum of care. I feel that ROSA Hip is precise and personalized for several reasons. Precise in the robotic assisted placement of components on the acetabular, and then on the femoral side, getting leg length and offset. This has been shown to be reproducible, reliable, and accurate in testing. I think it certainly offers a very personalized aspect to care. We have the preoperative assessment of the individual patient. I have other adjunctive features like spinal pelvic alignment to assess and place patients in different buckets from hypermobile spines to stiff spines. I can take that data and then feed it intraoperatively into the ROSA Hip application through the One Planner Hip system to personalize that individual patient's prosthesis, but then also certain parameters associated with that patient to really give them a personalized experience at the time of surgery. I can then tailor data from the preoperative episode of care to the postoperative episode in really taking some of this data from my mobility and other data elements and really carry this through the surgery and into the postoperative period. So the ROSA Hip application has a very personalized workflow and should be an extension of the surgeon's current workflow associated with anterior hip replacement. The anterior hip replacement can be done on a fracture table such as a HANA table, or it can be done on a regular operating room table, really personalized or tailored to the individual surgeon's preference for how they normally would perform their anterior hip replacement. Using fluoroscopic guidance, we ask that the surgeon obtains good quality images of a standardized AP pelvis as well as an AP hip x-ray. And based on these baseline x-rays, as well as key validation and navigation images that are generated with robotic assistance, that really helps that surgeon fine-tune cup placement, but then it has also implications for generating meaningful data from a leg length and offset perspective once the final construct is in place. So the robot, in a very time-efficient manner, allows the surgeon to add the benefits of robotic assistance and meaningful data capture with actionable data items, and really not extend the length of a typical procedure for that surgeon. I'd give several pieces of advice to the surgeon who is interested in ROSA Hip, or certainly just starting out with implementing ROSA Hip in his or her practice. I would say that in the current application workflow, I would like the surgeon to be comfortable with an anterior-based total hip approach using fluoroscopic guidance. I think adding ROSA Hip application into that workflow is a seamless integration, but I would really encourage that surgeon to be familiar with anterior hip replacement surgery, as well as getting good quality x-rays and fluoroscopic images at the time of the surgery. If that surgeon is comfortable with anterior hip workflow, as well as interpretation and obtaining good quality images, the ROSA Hip application is actually a seamless extension of that, and really is a quite easy application or introduction into that surgeon's practice. There's no preoperative CT that's needed. There's no pins or additional exposure that's needed intraoperatively. It's simply using the fluoroscopic guidance that a surgeon is used to using in their anterior hip workflow, and then applying the robotic application principles, and then really getting a lot of meaningful data throughout the procedure. And I think interpreting that meaningful data is helpful and provides a very personalized solution for that particular patient and that particular surgeon. My current construct in the majority of my hip replacements in primary hip replacements at this time is a Avenir complete collared stem paired with a G7 acetabular system using highly cross-linked polyethylene and a ceramic head for the majority of my patients. I find the compaction broaching philosophy of the Avenir complete stem paired with a collared geometry, which affords extreme axial and rotational stability, allows for bone preservation, but also solid fixation and reproducible results. I like the broaching aspect in the system that's been designed with the Avenir complete system. I like also working within the Avenir family of different stem geometries that are available to me in terms of neck shaft angles. And then on the acetabular side, the G7 cup has really been a workhorse for me. It offers a tremendous amount of flexibility. It offers adequate sizes and head to shell size ratios, and then offers the ability to use dual mobility articulation if needed in selected patients. I'm really excited about the ZB Edge offering that Zimmer Biomet has at this time. I think we're really at an exciting time point where we're now marrying solid implants, industry-leading implants, with really actionable data and meaningful data that's going to be helping our patients. The ZB Edge platform offers the ability to link preoperative data with now robotic execution and the data that's derived at the time of surgery, and take that and couple that with post-operative data to follow our patients throughout the continuum of care. I think this data really offers us the ability to start thinking in bigger picture, start understanding the patient not only on the individual level, but also in themes and in certain buckets of patient activity, patient expectations, and then also understanding in the future really where we might take this. It's really exciting that Zimmer Biomet now offers this ecosystem of digital benefits to the surgeon and most importantly to the patients.